Okay, so let's pick up on the portion concerning normal skin color determinants and what some of this means. Um, the major contributor to skin color is melanin. We have cells called melanocytes, and they make up about 8% of our cells. For in the stratum germinativum, they actually produce melanin and feed it into these cells make melanin and feed it into the other keratinocytes. Those are the ones that make the other stratified squamous epithelium. Now, we all have the same percentage of melanocytes. It's just how much melanin is produced that determines the depth of the skin color. And the melanin that's produced can also have either yellow, brown, or black pigments, depending on the nature of the melanin. Another thing that will alter skin color is carotene. And this is an orange-yellow pigment that comes from some vegetables. People who have eaten a lot of carrots will sometimes have an altered skin color. If you're a person who carries around a little pound bag of baby carrots and you're eating those all day, you will get this kind of orange. Looks kind of like a copper tone tan, and I have an image of some folks with that on the following pages. Hemoglobin, blood coming to the skin, will alter skin color as well. A red coloring from red blood cells. Oxygen content will determine the extent of this red coloring. So again, someone looking at your nail beds will be able to tell a little bit about how well oxygenated you are based on the coloring. What will happen is that if the blood is not well oxygenated, the blue of the connective tissue will start to show through, and your nail beds can actually have kind of a bluish cast to them. Additionally, if you have been poisoned with carbon monoxide, that causes your blood cells to be a really brilliant red. I mean, much more intensely red than they are when they're normally oxygenated. As a result, you can sometimes diagnose carbon monoxide poisoning by this color as well. Now, the pigment melanin, as I said, produced by melanocytes, about 8% of the cells, regardless of skin color. Color produced is yellow, brown, or black, and the amount of melanin produced depends on a couple of things. That is genetics and exposure to sunlight. Exposure to sunlight will trigger the melanocytes to make more melanin. This is a protective mechanism. There's already been damage that's been done when you start tanning. What the body is trying to do is keep you from doing more damage. So there truly isn't anything like a healthy tan. Okay? Now, genetic factors also come into play. And again, it's that combo that determines overall skin color. Now, diagnostic significance of skin colors. Well, if you are bluish in color, you may have cyanosis, and that's due to low oxygen content, which could be a product of poor circulation, heart defect, or some other cause. There are poisons that cause that. In fact, cyanide is called cyanide because it makes you turn blue. And then there's something called colloidal silver toxicity. This is argyria, and it's not a poison in the normal sense. What happens, though, is silver's the same stuff that's used in photography. It reacts with sunlight, and so a lot of people take colloidal silver, like a nasal spray or something like that, which does kill lots of microorganisms. The downside is that it gets absorbed into the tissues and can end up making you permanently discolored, actually kind of permanently blue. This is not something that goes away, and I have some photos of that as well. There is a yellow color, jaundice, and what's going on there is a buildup of bilirubin. Bilirubin is a breakdown product of blood, and the liver is what processes this, makes it into bile. If the liver is not functioning properly, it simply cannot clean this out of the system, and this will build up in the tissues and give you this yellow color. You'll generally see the first indicators of jaundice when in the whites of someone's eyes. There's also something that babies will have when they're born. Again, it takes a couple of days after childbirth for the liver to come really to become fully functional, and the bilirubin is a product of the breakdown of red blood cells. Baby has gone through the birth canal. Essentially, there's a lot of kind of tissue squeezing and damage, almost you'd say bruising. There are lights that babies can be exposed to. They're called Billy lights, and that will get rid of the jaundice. By the same token, the child can be exposed to sunlight, and that will also take care of the jaundice. As I said before, you can have this orange color. Certain vegetables will do that. There are also drugs that will alter your skin color. You can have reddish skin, which can occur from, first off, being overheated. Blushing, embarrassment, or anger can also come into play here. And carbon monoxide poisoning, as we mentioned before. So I've got a couple of images. This person has argyria. This is where they have been using colloidal silver, and it has become embedded in the tissues, circulated through their skin, and they are now blue. And they are blue for the rest of their life. This doesn't go away. Well, what we see here, remember I said that looking at the hands can be a good diagnostic tool. This is cyanosis. In this particular case, it's something called Raynaud's syndrome, where you end up with poor peripheral circulation, and you can see that the fingers are actually this bluish color. Carbon monoxide poisoning. And I don't know how well you can see this. This person has a lot of splotchy reddish coloration. This is jaundice. And note the yellows of the eyes. Now, I remember the movie Christmas Story, and he was talking about this kid named Scott Farkas. They said he had yellow eyes. I swear to God, he had yellow eyes. That kid probably had some form of jaundice. Now, hyperkeratonemia. Here's mom. Normal skin color. I don't know if you can tell, but this child is orange, or somewhat orange. And let's see. You could, I suppose, get really bad. I'd say the Oompa Loompas, maybe they just ate a lot of carrots. Now, we've talked about some of the diagnostic characteristics of skin color. Let's talk a little bit about some imbalances, some homeostatic imbalances, infections, and things like that. So we're going to start by talking about athlete's foot, which is tinea pedis. It is a fungal infection. Fungi live off dead tissues, and the surface of our skin, those tissues are all dead. Fungi also need a moist environment. The fact that we wear shoes and our feet can get wet, that can contribute to athlete's foot. Now, athlete's foot, that's tinea pedis. Jock itch is actually tinea cruris. They're the same microorganism. Um, the treatment is the same. There's a number of sprays, miconazole, tolfinate, those types of things. And the interesting thing is that the stuff used to treat athlete's foot, if you look on the can, it is exactly the same as that for jock itch, but the stuff for jock itch costs us much more. So if you end up with that, just use athlete's foot treatment. Now, boils and carbuncles, these are caused by bacterial infections. Quite often, what we end up with is some bacteria that has migrated down a hair shaft and ended up becoming encysted in some way or another. Now, this last one, cold sores, this is caused by a virus, and it's not a skin condition. It is a condition of the nervous system that has skin manifestations because we have sensory nerves that go to the surface of the skin. And when this virus gets out of a latency phase and starts growing in the nerve cells, it migrates down to the ends of those cells where it gets shed. So we'll talk a little bit more about that in a few moments. Actually, I think this is probably a good place for us to stop. We will pick up talking about additional homeostatic imbalances, beginning with cold sores, and our next presentation. So thank you.